And this is Distinctive Delphine in Montrose, Colorado. Today, I have the pleasure of interviewing Dr. Rusty. Dr. Rusty is a chiropractor in Montrose. Hi, Dr. Rusty. How are you today?
Doing great. How's it going? Thanks for having me.
Oh, it's doing great, especially after my adjustment today. I feel a lot better. So, why don't you tell us a little bit about yourself and what you do?
Sure. I'm a doctor of chiropractic over here in Montrose, Colorado. And I integrate chiropractic and physical therapy and some massage if necessary for all my patients. And yeah, I just have a one-man shop. It's just me. I don't have any receptionists. There are no other doctors. It's just a small little office. And I like it that way. I just transitioned to this model about 2 years ago.
Mhm.
And it seems to be working well. I've got a great relationship with my patients and good, rapport. There's no one to call in sick.
That is good.
So yeah, I like it.
That is good. And talking about calling in sick, and let's just dive right into it. How do you see your patients, and what is your protocol right now to take the precautions that are necessary with COVID-19?
Sure. So right now I am doing lots of different things. The first one is I'm scheduling my patients 30 minutes apart. That gives me time between patients to clean the table, wash my hands, re-glove. I've been wearing gloves with each patient or with each family of patients, as well as a mask. I've got a couple different masks, but even the cotton ones that I have the polypropylene sheet insert. So just doing that for people. And as far as the patients, I just kind of go with whatever's comfortable for them. If they want to wear a mask and gloves, they are welcome to. If they just want to wear a mask, they are welcome to. And if they don't want to wear a mask, then that's fine too. It can be difficult to breathe face down on a table with a mask on,
Mhm.
so I get that. I'll still wipe everything down and make sure everybody comes in for an adjustment and nothing more than that.
And talking about the adjustments, chiropractic care is fascinating to me for how much it helps. I could have a headache, I could have aches and pains that I had no idea in the past that could be fixed with one adjustment. So, as you know, I come in quite frequently because for me, on a day-to-day basis, whether it's jumping on the trampoline with the kids or, doing any fitness, it will change everything in my body. And sometimes just things go wrong a little. And so
Right.
I like to prevent it, but I know not everyone does that. I do like the way that you charge so it allows myself to be able to come more often and always be aligned, which is really helpful for me personally. But so why don't you tell us first, how can chiropractic care help, and in which area it helps the most? And then secondly, talk to us about the way you make it affordable for everyone to be able to have chiropractic care.
Sure, sure. So, chiropractic is a treatment for the musculoskeletal system, but because the nervous system is so integrated with the musculoskeletal system, we are also helping to relieve any pressure on nerves. And so, probably the easiest way to explain chiropractic is that, it is a mechanical solution for a mechanical problem. So many people are taking chemicals like ibuprofen and Tylenol and Flexeril and whatever else to solve their very mechanical and musculoskeletal problem. And so chiropractic is a different approach to that. When you have aches and pains, those are symptoms that are telling you, hey, something's wrong, something needs to be addressed. And as a chiropractor we use a lot of chiropractic techniques, but also physical therapy techniques because I'm trying to address the mechanical problems that can happen through injury. And, sometimes the injuries are obvious, like you said, jumping on the trampoline, you fall, you're like, crick in the neck. But then some injuries can be kind of a slow and over time. Okay. We call those micro traumas. Basically, if you sit behind a desk all day long and you're hunched over typing away, that adds up over a long period of time. And repetitive stress syndromes and micro traumas, very much, can be helped with mechanical solution like chiropractic, massage, physical therapy. And that's kind of what I offer here. Now, when I say massage, I'm not doing like an hour massage like a massage therapist would do. I typically am massaging just the one muscle that won't let a certain joint move appropriately, or, it's very pinpoint or spot massage. My appointments are a little cheaper than everybody else's in town, mostly because I have a lot less overhead because it is just me. I don't have to pay a lot of people, and I am comfortable passing that savings along. I charge the same price chiropractors used to charge in like 1992. It seems to work,
Yes.
Uh,
For sure. It works for me, I'll tell you that. I
like when it's affordable for people. I don't like when people hem haw about how much it costs. Like a new adult patient for me is only $60. I don't charge some exuberant exam fee. We do an exam, we figure out what the problem is, and we get to work. Okay. Also, every visit is the same price. When you come in for a follow-up, it's $40, no matter if you hurt your knee or your back or all of it. I don't charge extra for each body part. I don't charge. It's my follow-up appointments are just $40 for the whole body. Okay. So that helps people, know the cost up front. You're never, I'm probably one of the only doctors I know that, I have the prices listed in plain English. You know what you're going to pay before you walk out or before you even start the treatment. And I like that. I don't like to surprise people. Oh, by the way, I had to adjust your elbow, so now it's $100 instead of $40. I don't like to play games like that. I also do offer prepaid packages for people if they want to, if they know they're going to use my services repeatedly, they can prepay for a package of 10 visits, so $400. But then I will add on 2 extra visits to their little punch card. So they prepay for 10, but they get 12. And that's helpful for some people. Even though I don't accept debit or credit cards, mostly because of the fees and because I already charge less than people, I do accept health savings account cards because you've already paid for the services into those accounts. So I do accept those kind of payments. I don't bill insurance, which is another reason why I'm a lot cheaper than some of the other doctors in town, because I'm not spending days on end sending all these claims in. In my experience, when you bill insurance, you probably only get paid for 6 out of 10 of the visits. Then that drives up the cost for the patients, So I don't do that.
But it's important to say too that even though you're not doing it on your end, your patients are absolutely free to do it on their end.
Totally.
So if they want to take the time, they can. So it's not that you're not covered by insurance. You just don't do the work. So as a patient, I can just submit it to my insurance, make my own claim, and get my money that way. Correct?
That's 100% true. And every patient that comes in, I have to do a medical chart and a medical record, which includes diagnosis codes, treatment codes, a prognosis, and a treatment plan. So that's all part of it. I have an electronic system. Actually, all of my paperwork is done on an iPhone. I have no paper in my office. iPhone and iPad. And so, I can just email a PDF of your visit that will have everything your insurance company actually needs to reimburse you, if they'll reimburse you.
Yes.
That's how. Right?
Well, which the thing that you can say is know your insurance, which is tough sometimes because they're so complicated.
Most people, I found that most people don't know how their insurance works. They don't know how deductible works. A lot of times you start the year off with a $5,000 deductible. That means that everything that you're going to use in the first few months of the year, you're paying out of pocket, right? Mm-hmm. And so you could submit it and they'll say, okay, that'll go towards your deductible. And, a lot of people just don't understand how insurance works that well. So, I don't ever guarantee that they will get reimbursed, but I have all the information they need to get reimbursed. It's whether their insurance company will allow it.
Awesome. Awesome. And then tell me a little bit more. I know that for me, stress is a big part of how sometimes I get totally locked in. I can wake up in the morning and not be able to move my neck. How can you help there?
Sure. So stress is, every thought you think could be stress or emotional stress, right? So, people talk about the mind body connection and they think, oh, that sounds a little hooey. But an easy way to explain that is you can see when somebody is sad on their body. You can see their muscle tension, their muscle tone, their posture. You can see when somebody is sad. Just like you can see when somebody's happy or feeling good. You can see when somebody's athletic or somebody who's been sedentary. And so emotional stress is, every thought you think ends up being a chemical reaction that then causes muscle spasms or undue tension.
Mm-hmm.
And that can surely add to any traumas that you've had in the past. Old injuries can be affected by stress or made worse by stress.
Mm-hmm.
Um, and then stress in itself, it's always going to decrease your immune system, especially when it becomes overwhelming. There's two major kinds of stress: acute stress and chronic stress. And acute stress can be good. For example, if you see a bear, acute stress is, hits your body hard. You have that adrenaline or epinephrine response, and you run from the bear. So that's a good kind of stress to be able to produce. But if you're constantly running from that bear, maybe it's bills or business or kids, whatever, if you're constantly running from a bear, your body will become overwhelmed and exhausted. And we start secreting other hormones like cortisol and things like that.
Yeah.
And that is kind of an overwhelmed scenario, and that will lead to illness and poor tension and poor posture and just the works. So yeah, stress is a big part of what we do. And I teach over at the college, the Colorado Mesa University, and I teach health and wellness. And a big part of that health and wellness college class is stress management, stress reduction, how to cope with stress. So a big part-time job that I have is to educate people on how to manage their stress. And sometimes when patients come in for an adjustment, maybe half the time I spend with them is telling them keys to managing their stress.
Yeah.
So, you have to be a complete doctor. You can't just treat a symptom and have them go on their merry way. Sometimes you got to get to the cause of it.
Yeah.
So.
For sure, for sure. I really appreciate that because it's very important to me. And then the last thing I want everyone to know, because I don't think a lot of people do know that, is that it's okay for children to be adjusted. And it's actually quite crucial because when you're little, you can develop certain aches that can follow you through. And 20 years from now, it's going to be a lot harder to fix it, right? So tell me more about that because this is fascinating to me. And I always make sure, especially with the trampoline,
A lot of people think that chiropractic is some sort of an adult thing, but that's because of the mindset of our healthcare system and that we are reactive and not proactive, right? And so we try to fix things when we get old and broken. Well, chiropractic and the science of chiropractic can be started right from birth. In fact, I have seen patients, a few minutes old because birth is a traumatic process, right?
Mhm.
And if there's nothing to fix, then that's great, but we can at least check them and see if there's any joint misalignment or, joint dysfunction. But a lot of times, yeah, babies can be fussy and have all kinds of symptoms if they have a headache or a symptom they can't tell you about. Now, a lot of people get concerned, like, oh my God, you're going to adjust a baby? Well, the techniques are totally different. They don't have scar tissue and muscle spasms and muscle memory. So it takes very little force. I can a lot of times just push the bone back to where it belongs with my fingertip. And kids, if you've had kids or watched kids, you watch them just, lawn dart right in the head first into the, like, what are you doing? They don't think about their spines, but I tell parents all the time, as the twig is bent, so the tree grows. If they're crooked when they're 10, you can imagine the kind of things they're going to be struggling with when they're 40 and 50.
Yep.
So it's like, get them fixed now so they don't have scar tissue and, all these joint damage, It's like if they break a bone, you're going to go get that set, right? Get it straightened out. Well, then why would you do that for the joints along the way? A lot of parents just think, oh, rub some dirt on it, walk it off, you'll be fine. And kids can heal. They will. And just like if they had a broken bone, they will heal with that broken bone if you don't set it, but it'll heal crooked.
Yeah.
And so if you have a joint injury, they will heal. It just might not heal appropriately, and then they'll be struggling with that the rest of their lives. So yes, infants and kids, the science is overwhelming. There's lots of clinical trials. A lot of people don't know that chiropractic has been studied to the nth degree, mostly from people trying to prove it doesn't work, which just ends up showing more conclusions that it does.
Right. And it's also, just throwing it out there, it's also half price for children up until 13, I believe.
I do offer half price for children up to 13. It's more because I don't want there to be a roadblock for parents. They're not sure, I don't know if my kid needs to be adjusted or not. It's like, it's $20 for a follow-up appointment for a kid.
Mm-hmm.
And then, for infants and stuff, if your kid doesn't have a misalignment and there's nothing to fix, I'll see him for free. Okay. I just want to check. Let's just see. Then at least you'll have the peace of mind. Okay. And then if there is something to fix, it's $20. Okay. You're not going to go broke, but you will have the peace of mind that, hey, my kid's going to be able to function when they're 30, and be able to pick up their own kids. Yeah. That's so important, and babies are interesting to me because they're so reactive. When you do a little adjustment, the tip of my pinky, I push the little bone back to where it goes, relieves all this joint pressure and sometimes nervous pressure, and they sleep better, and they don't have the fussiness, or they don't have the colic and the stomach issues, the gastrointestinal issues. They're going to the bathroom like they're supposed to. And so that's a big part of what most chiropractors are trained to do.
Yeah. Awesome. Well, thank you. That was a lot of great information. I really want to thank you for your time. Yeah. Is there anything else you want Montrose to know? Your music?
Well, I guess you should know that I'm back open.
Yes.
I am open, and I've got some precautions, but you don't have to be dying to give me a call. Okay. Don't be reactive, be proactive. Okay. It's much easier to fix somebody who's halfway broken than fully broken. You know what I mean?
Yes, I do. I absolutely do. All right. And quickly tell us about your music. Bring out the guitar.
Yeah. Sure. So she's referring to my band. I'm in a band called Neon Sky, and we play all over the Western Slope. We play legendary music. We play a lot of shows, 50, 60 shows a year.
Right.
Not this year, obviously, because I have played a couple virtual gigs for some virtual cocktail hours recently, which has been really fun. But yeah, I play guitar, and I play bass guitar and some keyboards, and I'm the lead singer. And my band just got sponsored by G&L Guitars, which is the company from Leo Fender right now. So we're really excited about that.
Congratulations. That's amazing.
So we'll be sporting their guitars all year. And we're excited about that. We've got like a matching fleet of them right now. So we're excited.
That would be exciting.
Yeah. So I don't know when our first gig will be. Depends on when everything gets lifted. But, hopefully this month. We'll get back out there. I think our very next show is at the end of May.
Memorial Day?
If they let us, it'll be May 23rd at Wingers in Clifton, Wingers Restaurant in Clifton, and then the Bridges May 30th for the Montrose Food and Wine Festival, if that's still going. We'll have to see. We'll see how that goes.
We'll have to see. Yeah. Well, thank you. That was really great to have you. It's really close to my heart, all that information. I've done osteopathy and chiropractic care my whole life. And so I know there are days that I just know that that's what I need, whether it's a headache, and it might take me a couple of hours to figure it out. But so thank you for always helping me and my family, because you make a big difference in our lives.
You're welcome. I'm happy to help. And I'm here.
Well, thank you so much. And you have a great evening and a great weekend. Everybody, will see you Monday.
Thanks. Have a good one.
Okay. Thank you. You too.
Bye-bye.
Bye bye.